Hi, I'm Liam Coffey from Muscle Doctor, and today we're looking at self-massage using a massage gun for the calves. So I'm using a pulse roll massage gun. Let's see how it's done. So sometimes positioning can be the most difficult factor when it comes to self-massage, but here I've just opened the leg out, I've got it resting on a platform on the seat in front of me. So we're going to begin with the first setting, and we're just going to lightly introduce the calf to the percussive element of the massage gun. So areas that we want to avoid here are any bony bits. So the medial malleolus, which is the ankle just here, want to avoid that. Want to avoid the inside of the tibia, inside of the shin, but we can go quite close to it. And then when we get to the top here, we run out of soft tissue. You'll know if you're on bone because you'll start to get this bounce, which doesn't feel fantastic. And then we just want to make sure we cover every square inch of muscle, trying to keep as relaxed as we possibly can. Slowly introducing more depth of pressure down into the Achilles tendon. We can absolutely treat tendons with massage guns. I found tendons respond very, very well to this percussive kind of tapotement technique. And then back up, slowly, slowly. As we find we start to get used to this, we can then increase. So I'm going to go to setting 2 now. A lot more intense, and we can see a bit more fasciculation there through the calves, which just means that twitching, the localized twitch response. And I'm going to work very slowly, trying to keep myself relaxed. If I find I'm tensing up, I probably need to use a bit less pressure and maybe reduce the setting. I want to take it as close as I can to the inside of that tibia, because then I'm going to be getting into the soleus, and ideally a bit of tibialis posterior deep inside there as well. So the calves generally on most people are quite sensitive, so just be aware of that. You can't take too much pressure, it's not unusual. As I find things are starting to relax into it a bit easier, I can increase the setting. Again, quite intense there initially, a lot of fasciculation going on. That's just the muscle's response to the tapotement, that percussive technique that the gun tends to use. And then finally increasing up to the last set. I'm not going to have to press too deep with this one. And my job now is just to hold that in place and relax. And if I feel anywhere particularly tight or tender, I can just keep that pressure constant there. My job is to relax. And eventually you should feel it start to ease, at which point you can move on. All the way down to the Achilles tendon. And it can be nice sometimes just to hold it in that spot on the tendon itself, not needing to press too deeply. So moving round into the lateral side of the calf, again down into the Achilles tendon, back up, trying to cover every square inch of muscle. Just be aware, not too much pressure into the back of the knee. We can get into it a lot easier here. You can give some pressure, but not too much. And also as we come around, you've got the head of the fibula just there, and the common perineal nerve not too far away from it. So just go very lightly and try not to bump into it, because you will get something that feels a bit like an electric shock. And we can continue to work all the way around the side, not too much pressure into the perineals that are going to be on the outside of the leg, and then also down into tibialis anterior. You can see we're getting that bony bounce now, which doesn't feel as uncomfortable as it probably looks. But let's move along. We want to move into the soft tissues, into the deeper areas where we're going to get a better response from them. How long do we do this for? 10 minutes max. Longer for a bigger muscle group, shorter for a smaller one.